The state releasing new data to 5 Investigates that shows how the pandemic impacted youth sports in Massachusetts over the past 2 years.
Our Mike Beaudet is crunching the numbers and looking at the impact of COVID-19 on kids who play sports. Take a look.
On the ice in Bedford, Concord Carlisle against Wayland Weston. This is what girls' high school hockey looks like 2 years into the pandemic.
COVID's gone through almost our entire team at this point, but luckily for us, it's been a few at a time.
Concord Carlisle girls varsity hockey coach Stephanie Yonley says it's been challenging navigating the ups and downs of the pandemic, but this year has been easier.
Knowing right now that the symptoms have been pretty mild, everyone on our team is vaccinated and boosted, I feel like the safety part of it isn't as scary as it was last year.
The biggest reminder COVID-19 is still here, players remain masked.
You know, at first it was definitely challenging because it's a whole new thing that we're not used to, but definitely you get used to it after a while.
As the MIAA moves to allow student athletes to remove masks starting March 1st, if their communities agree, 5 Investigates is looking back at the sports most impacted by the pandemic. Data we obtained through the Department of Public Health reveals that since July 2020, the state has tracked more than 420 COVID-19 clusters tied to sports in Massachusetts, with the virus infecting at least 2,000 athletes. A cluster is defined as at least 2 confirmed cases in different households within 2 weeks, where transmission likely occurred during any part of sports activity, from a practice or game to traveling on a bus or carpooling. Most clusters have been linked to indoor sports compared to outdoor sports. Hockey saw the most COVID clusters, followed by basketball, football, dance, and soccer.
You know, last year we had a couple of kids from time to time throughout different sports, but for us, hockey was not an issue, wasn't an outlier.
Keith Mangan is the director of athletics for Bedford Public Schools and president of the state's Athletic Directors Association. He says it's been tough balancing the positive impact sports can have with the risk of COVID.
But most of our kids have done what we've asked them to do. And because they want to play, they don't want to miss out and not have that opportunity.
Boston had the most sports COVID clusters, followed by Springfield, Reading, Framingham, Milton, and Peabody. The most extensive cluster dates back to March 2021, with 62 COVID cases connected to a cheerleading gym in Weymouth.
These shutdowns have hurt people on every level.
Dan Lebowitz is executive director of the Center for the Study of Sport and Society at Northeastern University.
And one of the things that this pandemic has done is create an incredible sense of isolation for a lot of kids.
Lebowitz says sports and other school activities are critically important for young people.
It allows those kids sort of that collective community to feel like they belong to something. And I think it's important that we keep mindful that if kids don't feel like they belong to something, that isolation turns into mental health issues very quickly.
The state tells us it monitors this data to look for higher risk sports. For example, it was used back in October 2020 to support the recommendation to pause hockey activities for 2 weeks. The data does offer some promising news. This January, the state tracked just 2 COVID-19 clusters to sports, compared with 71 in January of last year. Mike Beaudet, 5 Investigates.